At least one case of hand, foot, and mouth disease is now confirmed at a southern Colorado school. And a parent is asking tonight why the district isn't letting other parents know.
KRDO News Channel 13 Scott Harrison is live outside Talbott Elementary in District 3. And Scott, doctors say this disease is often misunderstood.
Well, guys, the parents of a 9-year-old girl who has this hand, foot, and mouth disease did not want to talk on camera, but say they noticed her symptoms last Friday. They're baffled the school isn't taking action, and so are other district parents. Although hand, foot, and mouth disease is a common childhood ailment, it's just as commonly misunderstood. It can be so mild, many kids may not even notice it. This is a picture of a student at Talbott Elementary who's recovering from the disease. You can see a few blisters on her hands. But it also can be severe enough to leave painful blisters in and around the mouth and on the hands and feet. Parents in the district say they weren't aware of the situation and should have been notified.
It does concern me because I do have a child here, and I would like to be informed because that's something that I need to watch for, you know, because I need to tell him to wash his hands more.
But a district nurse says it's unnecessary for parents to be overly concerned about a disease that has no treatment, only lasts around a week, and is generally no worse than a cold.
It's fear of the unknown, and then being upset that your child, you know, has come down with this illness, and if you're unfamiliar with it, it can cause some alarm.
The El Paso County Health Department agrees.
And often, you know, the contagiousness starts often before the child is ill. So, you know, trying to do that doesn't make a lot of sense for this particular infection. It might for other things, and for sure something like measles.
Health experts say making sure your kids wash their hands, especially after using the restroom, will help control the spread of the disease. And we have also learned that there are 2 more unconfirmed cases of that disease here at the school. But it isn't just elementary schools at risk. There are several outbreaks going on right now at several major college campuses across the country. We'll keep you updated on this situation. We're live in Security Widefield tonight. Scott Harrison, KRDO News Channel 13.
Scott mentioned it may be hard for parents to notice if their child has hand, foot, and mouth disease. Key symptoms to look for are fever, loss of appetite, and sore throat. After the fever starts, painful sores can develop in the mouth. Then a skin rash with red spots or blisters may develop on hands and soles of the feet. There is no cure for that disease, but there are ways to treat it. Make sure to wash your hands with soap and water, especially after using the restroom. Clean and disinfect surfaces frequently, including toys. If your child has contracted the illness, keep them hydrated. Over-the-counter medications also help relieve the pain and fever associated with hand, foot, and mouth disease.